My name is Mbalim Konza. I am a third-year PhD student at Stellenbosch University in South Africa. I was one of the fellows involved in drawing up the open letter which we sent out to various organizations and individuals. The aim for the open letter was to draw attention to the need for increased investments from world leaders and people in positions to increase funding, to increase the commitment that they've made towards ending TB. We continue to see that TB impacts millions of lives and communities each and every year, and we've also seen that vaccines are an effective way of disease control. So we believe that increased investments into research and development of new TB vaccines is a key in which we can be able to end this disease that has a detrimental impact on millions of lives.
I'm Bello Alakiwa Abdissalam, a 50th medical student of Ahmadu Bello University, Nigeria. The world leaders need to fulfill their commitments towards funding TB vaccines research and development. Not only because with the new TB vaccines, the world will get rid of TB, but also it will help the world to effectively prepare for future pandemics.
Hi, I'm Zetsu Sonyoga. I'm an MSc candidate at Stellenbosch University and part of a production team at Care Biologics South Africa. It's been a decade since the discovery and implementation of the BCG vaccine, which is no longer effective in protecting adults and adolescents against TB. We need efficient TB vaccines that will help contain the spread of the pandemic that is claiming millions of lives and stop the spread of the TB-resistant strains. Investing in TB vaccine R&D will help us eliminate TB forever. Yes, we can end TB through investing in TB vaccine R&D.
I am Dr. Joseph Mwaka. I am a vaccinologist and a doctor by training. I work at the refugee settlement in northern Uganda. I believe that we can end TB if we developed new, superior vaccines which can overcome the limitations of BCG vaccines.
TB is not just a health issue, it's a full-blown crisis that is consuming our economy, our future, and very humanity. It is wiser to prevent TB from happening rather than auditing aftermath of the disease. As a TB survivor and fellow of TB vaccine advocacy fellowship, we fellows have drafted an open letter addressing world leaders to accelerate investment in TB vaccine research and development. I hope this letter make noise, serious noise, and encourage those in power to consider prevention as part of the TB care and accelerate investment in TB vaccine research and development. Thank you for listening.